future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
Welcome to this episode of Smarter Healthcare with AI. Today, I'm so excited to be joined by my colleague, fellow alumnus, and incredible service member, one that has done incredible things, Mr. Neil Chaudhry, who's a senior advisor for artificial intelligence at the Department of Transportation. Why I'm particularly excited about this episode is because you might be thinking right away, what does transportation have to do with healthcare? What does transportation have to do with smarter healthcare with AI? And you're going to find out during this episode because we have a true savant in that field. And we're going to learn all about how AI, healthcare, and transportation are inextricably connected. So welcome.
Thank you. Thank you for having me.
Yeah, thank you. There's a lot we can talk about and discuss. We share a common alma mater in the National War College. Both have served in the military, and you are currently serving the Department of Transportation in a senior advisor capacity for artificial intelligence. So tell our audience, what exactly do you do? How do you spend your time, and how did you come to be in this incredible role?
So yeah, it's once again it goes back to, I think, what I tell most folks that I know. It's primarily about luck and timing.
Luck and timing.
Right. And but the thing is, using that Malcolm Gladwell 10,000 hour analogy, right?
Sure.
You have to be prepared to take advantage of luck and timing. It just doesn't happen. So if you look at my career arc, right, left the military, and I was a logistician in the military, U.S. Army Transportation Corps.
For the audience, what is a logistician?
So a logistician is somebody primarily, in the military who supports the infantrymen, the sailors, the Marines, the fighter pilots, making sure that they have exactly what they need when they need. So, served in Korea, served in Iraq, other places as well, and pretty much U.S. Army Transportation. So trucks, trains, and surface transportation management. Got out, came back into the government as a presidential management fellow.
Yeah.
And because of my background...
What was the timing of that?
That was 2009.
Yeah, okay.
So came back in, and, logistics, contrary to popular belief, isn't just about, people doing physical things.
Yeah.
There's a lot of data and knowledge management that goes in the back end.
Sure.
And, I cut my teeth in, ERPs and, databases to be able to manage logistics.
Sure.
So I already came prepared a little bit. And my first assignment back in government was at the Defense Business Transformation Agency. And the role that, I was fortunate enough to have was with the Warfighter Division, specifically to help reduce logistics complexity in theaters of war, where we have a combination of military, supply distribution systems, then we have civilian, then we have third country nationals, and it's a very complicated space where, something might be applicable or easy to do in the United States, but when you get to a foreign country, you realize you can't transport the pallet because the trains are different gauges, which means, you could put two pallets side by side on an American rail, but when you get to, a British rail, it's narrower, so you can only put one pallet, and you have just reduced your capacity by 50%.
Right.
So things like that we worked out, and the data, the business intelligence aspect of data is where I really cut my teeth in government. And it was about logistical enterprise resource planning systems. So for your audience, some of them may know the names like Oracle and SAP.
Sure.
Implementing those really complex billion-dollar systems was my first entry into government in technology and logistics.
All right.
Coming from there, went to U.S. Customs and Border Protection, did about 10 years there, and a lot of things, but things that are applicable to AI nowadays is, from a governance perspective, reaching data, working on data sharing agreements with foreign governments.
Right.
And that teaches you a lot about privacy, about what you really need in order to, get something done.
Right.
You don't need all the data. You just need to be able to be smart enough to say what pieces of the data you need.
Right.
Then recruited into the last administration with the Office of American Innovation, and then running the Federal AI Center of Excellence over at GSA, followed by a stint in the Office of the National Cyber Director at the White House, followed by now Department of Transportation, where I support the Assistant Secretary for Research. And this is about luck and timing,
Right.
where my role isn't what you traditionally see as, the AI advisor in government, where it's the chief AI officer.
Yeah.
So I don't support the CIO office. I don't work in the CIO track. I work on the program track and the research track.
Right.
So it's a very exciting space. It allows me the freedom and flexibility to try different things as opposed to just focusing primarily on compliance.
Sure. So you kind of glossed over something that's critically important, but I want to make the
Yep.
point for the audience about how important logistics is in not only our warfighting missions, but for healthcare. So when we think about logistics, right? We are part of logistics. Healthcare are part of
Yes.
logistics in operations. You don't think of it that way, but we are. But we also know, and you and I, went to formal national security
Yeah.
training about how important logistics are. But you talk about beans, bandages, and bullets, right?
Yeah.
Getting to where they need to be when they need to be there. And we remember, I'm sure you do as well, because we studied all of these war campaigns and from the Peloponnesian War to the
Yep.
present campaigns. And one thing became very clearly clear to me, and I'm sure you've lived it in your world experience and in your professional experience and personal experience, is that logistics was what wins campaigns.
Yeah. And
And unravel that a little bit. Really, I don't think the audience really appreciates that, but you can have the most sophisticated machines and weapon systems. You can have the most capable
so
war
I'll
fighters.
actually bring this back to the civilian world, if you don't mind.
Sure, yeah.
So here's something that maybe your audience doesn't realize. And, we have had testimony on the Hill on this, so I can talk about it, but there are other aspects to this
Sure.
which we can't talk about. But in general, some of the testimony that's already been provided on the Hill has these anecdotes like we only have about, as United States as a nation, about 87 days worth of penicillin and antibiotics,
Mm,
after which we don't have any. Same thing with it's only about 70 something days of Tylenol, because we don't manufacture medicines in the United States
right,
anymore, especially, low cost generics, but that have a transformational effect. Penicillin, acetaminophen, right?
right,
Ibuprofen,
right.
Neosporin, any of those things, bandages,
Yes,
band-aids, right? We don't manufacture those in the United States anymore, and we only have about 80 days worth of supply. And primarily, if you look at the global supply chain for medical logistics,
right.
all the precursors are 94% or 93% of precursor chemicals required to make drugs
Yeah,
are manufactured in China, right? And then about 80 something percent of the manufacturing of generic pharmaceuticals happens in India, to include a significant portion of vaccines,
right,
right? And then from there, the transportation network, right? By the time it gets on a ship, by the time it needs to get to United States, all we need to do to basically shut down all the hospitals in the United States is for the Chinese government to say, 30-day pause on, precursor chemicals,
Correct.
right? And the whole global supply chain for any medicines will stop, which means every elective surgery in the United States stops, right? We don't have any bandages for trauma. We have to start to prioritize, and we actually get in a worse situation than when we had in the pandemic.
Right.
And being able to, folks are like, oh yeah, we can just convert, a alcohol distribution facility and we can make hand sanitizer. That's easy, right? But if you're trying to talk about band-aids and, the
Drugs.
clean facility required to make, a band-aid that doesn't have germs on it,
Yeah, sterilized. Sure.
the sterilizing is a completely different animal, and you can't set up, a facility just like that.
Right.
So you say, who are our global partners that might be able to help us out?
Mm-hmm.
For sterilized equipment, maybe the Germans, but that's about it,
That's about it.
right? So we're talking about folks not being folks in pain because they can't get pain medicine,
Right.
right? Over the counter pain medicine, no elective surgery. So basically, about half our rural hospitals going out of business,
Yeah.
right? Because the money primarily comes from elective surgeries,
Right.
not from the really low reimbursed Medicaid
Sure. Yeah.
reimbursements for,
Right.
so it's a very critical piece that folks, I don't think, have grasped, that we need to really understand our global logistics chains for commercial medicine in United States, and then also what is our backup strategy?
Right.
Because I mean, you know this from your time, and your audience also knows this, is MedLog is one of those very medical
Yeah.
logistics
Medical logistics. Yeah.
is one of those critical areas where things expire faster,
Correct.
and cold chains are critical. So it's not like lumber, or it's not like cement where you could stockpile it and leave it
Yeah.
around for
For a
years
long
and
time. Right.
years.
Yeah.
All this stuff expires, and it expires within months.
Yes. Shelf stability.
Yes, exactly.
Yeah.
And we don't even have the shelf stability and the space. We have never thought about these warehouses where we might stockpile things. Right. So it's a very dynamic thing that we need to start looking at this problem and applying AI to model this problem.
Well, I'm really glad you brought us to the civilian sector, because that's exactly how I wanted to sort of make the connection between the importance of logistics, the importance of how we've lived it in our own
Yep.
experience in the military, but how it has a critical implication in the civilian sector. And now you've kind of really kind of opened the package for the discussion of artificial intelligence. So all of those challenges that you just mentioned, and how critically important logistics is to the workflow of healthcare, the actual execution of healthcare in America. How do we and how can we use AI, artificial intelligence, to help mitigate some of those risks that you so articulately defined and
So, as a
highlighted?
nation, we are really good at advanced thought, right? When it comes time to, even HHS and National Institutes of Health, I mean, the amount of fundamental research that they do, it's unmatched,
Sure.
right?
Absolutely.
The thought work that we do to get new medicines, all that work is so, it can't be done anywhere else in the world, because they don't have, I mean, there's a reason why a lot of graduate students come
Come here,
here,
correct. Yeah.
right, to United States to learn, to
Right.
connect, to build networks, right? But the part that matters is that applied engineering part, where you're taking an idea and being able to scale that idea into not just one widget that's custom built, but a billion widgets
Right.
that you can make a profit on. And the Chinese have figured this out,
Yeah.
that it's industrial engineering that matters.
Yeah.
So even in AI, there's that aspect of AI where, even with the government and the Genesis project, right, where we're going to use supercomputers to determine, the future of transformative healthcare in terms of those medicines we haven't been able to
Yeah. Drug development.
right? So
Yeah.
it'll work really well. But in terms of the other aspect, the boring aspect of, how do we set up a factory? What is the ideal lot size
Right.
to be able to make a profit?
Right.
All those problems, when you think about, you say, how do we manage it? And also, with AI, can we use things like digital twinning,
Mm.
right? Where we can look and we say, we can put up a virtual hospital
Hmm.
and we can run a virtual simulated hospital with AI agents that take on a persona of a nurse, a medical assistant, a physician, a surgeon, a billing assistant, and have all those folks in a virtual environment,
Right.
right? With generative adversarial networks, because in large bureaucracies you do have
Yeah.
adversarial relationships, right?
Sure. Yeah.
Run all that and see where we can optimize
Yeah.
healthcare, and the logistics of healthcare,
Yeah.
so we can apply just in time in a risk-based way, so
Sure.
that what we don't have is a uh, understanding of what we need in terms of shelf-stable product. Order too much and it expires and we have to throw it away,
Yeah.
and then order more and then we're waiting for more. So being able to model some of these things, because it's not just about the sutures, it's not just about the band-aid, it's about the surgeon needing that thing when they're
When they
doing a
need.
surgery.
Yeah.
So if they are scheduling 3 surgeries, what's the optimal batch size
Sure.
for all the equipment they need to do that surgery and post-operative care?
Yeah. So what you're really talking about is building a more resilient
Absolutely, yes.
healthcare ecosystem, right? At the hospital level, but then at the system level and then beyond. And it's clear to me, and that's why I was so
Yeah.
excited to have you as a guest here, and how AI is inextricably connected, as a means to get to
Yes.
that, sort of nirvana where we can say, hey, you know what? Let's simulate some of these scenarios. Like, what will happen if the supply chain gets interrupted in this part of the world, or if we lose this input for this critical supply that we need to
Mhm.
create a medicine or a product that we need for surgery. That's incredibly powerful.
I mean, and I'll actually even build on that, right?
Yeah.
Think about, and this isn't something that I thought about. It's something that Bakersville PD out in California does, and I was so impressed. I decided to steal their idea. Right? Is what they do is they have drones. So
Ah,
whenever they have an incident and 911 call comes in, the first thing they do is dispatch drones off their rooftop. And what the drone does is give the folks situational awareness, so that before anybody even gets to the site, they know whether they need to send a SWAT team, whether they
yes.
need to send, just the care team or a de-escalation team. They know what they're dealing with before they even get there.
That's right.
And similarly, you could think about this model in, a paramedic comes to a location, an EMT comes to a location,
Right.
right? They could take a picture of the accident site, and using AI, we have already packaged what we need to treat that person at that ER by the time they arrive. So
Yeah.
when they arrive, we already have a bay waiting for them with the correct equipment, with the correct people, and we just took the time, that 45 minutes of wait time,
Right.
triage time, and we cut it down to 0,
Right.
just because somebody sent a picture of what the trauma was.
Right.
And by the time we transport somebody, they're ready to take care of the trauma with no wait.
So what you're describing obviously is happening. What
Yeah,
will it take for that to be the norm? That's not happening everywhere
it's not.
throughout the country right now. And what you're describing is so powerful. I'll tell you that, my background as
Mhm.
a surgeon, as a trauma person, one of the things that we talk about, right, is sort of the holy grail for trauma
Yep.
is imagine wearing glasses or some spectacle or something, and
Yes.
you see a trauma patient. And because of everything that you're gathering, all the data, all the input, you can tell exactly where the injury is, what's needed, how much blood loss has already occurred,
Yes.
how much do you need to resuscitate the patient. Now you're taking this a step even before that happens, before they even come to the hospital.
Yes.
Gather all that information, that intelligence, so you can make a better and informed decision. So we as trauma surgeons say, if we know what the injury is and we can have the
Yes.
insight into what it takes to treat that person before they even show up in our trauma bay. That's
I mean, and
that's
we're
game
talking
changing.
about, things like simple things like you had mentioned, right? Just using heat sensing, see where the trauma is, right? Being able to identify what the blood type is before you even put them in the ambulance, right? So that we have the correct blood type waiting at the trauma center, or we can actually, using our logistics change, right? And our AI agents know that, you know what, let's not take them to Louisville local. Let's take them to Memphis local because Memphis local actually has the supplies and Louisville doesn't,
Right.
right? Why would you want to take somebody who's got blood loss, O type, and they have no O type or they're running short on O?
Right.
Send them 10 minutes away, even further, because we know they have O type and they can get the package
Yeah.
ready.
And those critical minutes
Yes.
will be really the determinant factor
S-
for life or death.
And it's the modeling of it where you say it took us 10 more minutes to get to the trauma center, but we saved an hour and a half trying to figure out we don't have the blood,
Right.
and then we're putting them on an ambulance again to
That's
take them
needed.
elsewhere.
So this is incredibly powerful, and again, that's why I'm so
Yeah.
excited to have this discussion. Because again, you think Department of Transportation, AI, healthcare, how does that all come together? You're already given some concrete examples. How do you think we're going to be implementing this systematically into the future? I mean, it's happening now in pockets, right?
Yeah.
But
S-
how do we do it at scale?
So, the thing about United States, which a lot of folks don't realize, and especially if they've spent their whole life in like 100 miles where they're born and die within 100 miles
Yeah,
of
yeah,
where they were born.
where they
And
live, yeah,
a lot of people, a lot of majority of Americans are that way. They've, unless you're in the military or other, or you went away for college, you never get to experience that.
mm,
And there are a lot of folks in America, especially, from a enterprising innovators and whatnot, who, for just because of the density reasons, live in urban areas,
right,
and they don't understand rural areas. They
yeah,
don't understand the scale,
yeah, right,
right? I mean, we're talking about, your next door neighbor is an hour and a half away in
right,
rural areas,
yeah,
right? So the applications you have for logistics in urban areas are completely different than
sure,
rural. So, the solutions you're thinking about in urban areas, or the solutions you don't think about because they're not cost effective
hmm,
in urban areas, they would be really relevant in rural areas.
sure,
And it's about the interagency coordination,
yeah,
of how to make that happen. So, a perfect example of, you know, technology where transportation and medicine would intersect, right?
yeah,
Is drone delivery of medicines,
sure,
right?
yeah,
And because it's a wide open rural area, you don't have the overhead wires, you don't have the buildings, you don't have, you have
yeah,
a lot more space to actually maybe be 100 foot off the ground and be able to traverse. You don't need to go a mile up as a drone,
right,
but being able to take that truck from that Walgreens or that CVS,
yeah,
and instead of driving, you just have
and
drone delivery because most medicines are, they're the volume to weight ratio is pretty
pretty
light,
light, yeah,
right? So you could do multiple deliveries, you could do a bunch of things. So you don't need to put those medicines on a truck and deliver,
right,
right? So there's an ROI there.
sure,
Same thing with, in terms of even the logistics, and I keep on going back to this rural access,
sure,
right? Is that what can you do with AI and logistics networks, not just physical, but digital,
digital,
right?
yeah,
Where, you know, I have a second home in West Virginia, and it's in an area where we don't have cell coverage. You know, we have no landlines. It's
yeah.
pretty much disconnected from the
What
grid.
happens in those kinds of environments? You would need that infrastructure to
So
sort
we
of
have like
support
a
the.
CB radio as backup in our house.
Okay,
So we'd have to use a CB radio to call for help. So it'll
wow,
take at least 40 minutes for an ambulance to go down those mountain roads to come to our house to look at something.
wow,
And then if it's something where they're not equipped to deal with, how do we deal with that? Right. So going back to where we started, where how can that first responder get the tools to be able to attack that situation where we're cutting down the logistics time? And it goes back to they're not a surgeon.
Right.
But imagine if within that ambulance you had a digital surgical bay,
Uh-huh.
right? Where you could just take that patient, put them in that bay, and a surgeon can remotely take care of whatever they need to take care
Sure.
of. And then that EMT is there to, at
To
the end,
support. Yeah,
stabilize and
yeah, yeah.
support, right?
Yeah.
And you don't need to worry about taking them somewhere.
Yeah.
Other than when we resolve the trauma, then we're not in a time crunch to take them somewhere,
Yeah.
right? Same thing with medicines. How do we not just look at a county hospital, but how do we model and we build those supply chains, that can be anonymized so that we're not taking away a competitive advantage of an hospital
Sure.
or trade secrets? Being able to say the next batch of Tylenol that comes in, how do we equitably distribute it so that all the rural areas have enough?
Enough. Wow.
So all these things that we can think about, even with blood or organ transplant, right?
Sure.
How do we do it equitably? You know,
Yeah.
and and that's the thing where AI can really help with some of these problems. Where yes, in medicine, we always, just like in life, we always make value decisions,
Right.
right? Who to save, who not to save, whether or not the treatment is worth it, right? So
Mm-hmm.
we do make value judgments. It's not like we don't make
Sure.
value judgments, but how do you build that equitable thing in it so that folks who are in rural areas aren't disadvantaged because they're not in a denser area where there are more choices?
Yeah.
How can we use AI to create a mesh that we're looking at our whole rural area as one big urban area
One big
digitally?
ecosystem. Yeah.
Yes. And how do we use AI and our logistics networks to be able to fulfill that?
Yeah. So it's clear that you have been very thoughtful about leveraging AI to bring us to a better place in the future, right? To give us and those that need it the access to this incredible and I
Mhm.
would say very powerful healthcare system
Yep.
that we have, but it's usually limited to people that are in proximity to that.
Yes.
This infrastructure that you're talking about and actually applying AI can leverage what we have and expand it through transportation, through logistics to give more care
And
widely distributed to more people.
we even think about, when we think about going back to that very first prompt that you had,
Yeah.
what does transportation have to do with
What
medicine,
does that yeah.
right? Think about in going back to rural areas, right?
Yeah.
Because these problems get amplified over there.
Sure.
You say, you know, would you have a surgeon that's been driving for 4 hours operate on you?
Mm,
Right?
right.
Or would you have a surgeon that has access to an autonomous car and they can rest on their way to their surgery?
Right. Absolutely. The latter is much safer.
Right? And so that's how you could even think about these issues where you say, how do we get teams rested, prepared, so that they're not spending time traveling,
Right.
doing other things
Yeah.
other than prepping for their job?
Their job, their critical job,
Yep.
life-saving job.
So at the
Yeah.
end of their 12-hour shift, it's not like they've been up 18 hours,
Right. Yeah.
you know?
Well, this resonates entirely with me. I remember as a resident
Mhm.
being very tired and driving home. It's very unsafe, and many
Yes.
people have lost their lives and been harmed through driving while tired, and just the everything that you just mentioned. So it's clear that transportation. I hope we've convinced our audience now that transportation is absolutely connected
Mhm.
to all aspects of healthcare. When we think about anybody that thinks about AI, immediately there's this great potential. Oh, it's going to be great. It's going to be awesome. So much can happen. So many good things can
Mhm.
happen. What are the things we have to be worried about? When you think about safety, security, and all the things that you mentioned are great, but what could go wrong?
I mean, everything and anything could go wrong, right? And when we think about healthcare, it's not like, uh, the great thing about, I've lived overseas as you have. I grew up overseas, right?
Right.
A lot of places have a different perspective on things, which sometimes limits the potential of the population, right?
Hmm.
You're typecast early on.
Yeah.
Oh, they're just from a family of thieves. You know,
Mm-hmm.
that whole family is lazy, right? Those sort of things, right?
Hmm.
But in United States, the great thing about United States is nobody cares where you came from. It's where you can go.
Hmm.
So, bankruptcy law is a great example of this. You can take a risk and start over again.
Hmm.
If a certain town isn't working out for you, culturally, economically,
Yeah.
you can move elsewhere and start over again.
Right.
Right? That's the great part of America. And part and parcel of that is our implicit agreement with the government that we will pay our taxes on time, we will follow the laws, but we won't live in a surveillance state.
Hmm.
Right?
Hmm.
So, you know, library books are something that, we all care about. We don't want the government finding, like, keeping a list of what we read. Same thing with, medicine is a little more, we don't want folks who have no business knowing about our medical conditions that we don't want to, right?
Sure. Right.
And just a couple of years ago, we had this huge breach, with our psychiatric providers. You don't think about that very much, right?
Mm.
And all their, by their EMRs, they're required to digitally capture all their notes.
Right.
And a hacker came in and took away all their notes. So imagine your deepest, darkest thoughts, phobias, everything
Right. Just exposed.
is now exposed.
Yeah.
And folks are tying that into your billing, your address. They know where you live, they know where you work, they know how much you make, and now they also know your deepest, darkest secrets.
Yeah.
Right? So that's the real risk. Same thing with, trying to get a job. Imagine if your employer is able to buy your medical history and say, this person has enough medical problems. I don't want to hire them because
There may
it's
be a liability.
they're
Yeah.
going to be a liability, or they're going to ask for a reasonable accommodation as soon as they come here.
Yeah.
Even though you have come to the interview, you have done everything, you're like, I present myself as healthy,
Right.
but they see my medication list, they see all this, and they're like, oh, this person is just going to go, I don't want to hire them.
Yeah.
So how do you prevent all that, right? Because AI is all about, we need all the data, we need
Right.
to
Right.
hoover
Right. Yeah.
all the data. So how do you balance that? And that's always a tricky thing. And it's that anonymity that we need to build into the system, not during the whole system, but at the part where it starts interacting with people.
Sure.
So, AI is great when you can talk about, a 50 hospital chain, what we need in aggregate, this much blood here, this much blood there, these many, pills here, this sort of
Sure.
thing there, right? Depending on what they do, how we want to optimize it, the routes, all that. But the moment you don't want to use AI is, when we are taking somebody's information to help,
Yeah.
build
That's
a
sensitive
model.
information.
Yes. And not being able to anonymize it.
Yeah. Yeah. Well, de-identification is a very important attribute to building our AI models, right? We want to make sure in healthcare, we want to use that data because it's very important
Hmm.
because that informs the models, helps them to have higher fidelity. But you're right, when there is a breach and that trust
Yeah.
is broken, then there's a problem. So I think when you think about, everything that you just outlined, what are the measures in your mind as an advisor that
Hmm.
you sort of push for, that you advocate for when it comes to having that data security layer, having that individual data sovereignty for individuals, but yet have the
So, going
connections so
back
that you
to,
can, yeah,
a transportation sort of world, right?
right.
We all want to be able to track individual cars for traffic optimization. Sounds great, right? But imagine a use case where maybe I haven't told anybody about, my gender preferences, or, my preferences, sexual preferences, because I live in a a community where it's not appreciated,
Sure.
right? And all of a sudden, through tracking of these vehicles to optimize traffic, right? That
Yeah.
was the noble cause.
Right. Right.
Folks are saying right after church, you're going to a particular type of establishment
Mm,
and you get outed,
yeah.
right?
Unintended consequences.
Unintended consequences. So it's that, the sort of thing, the conversation I always have is no fishing expeditions.
Yeah. Oh, I
Say,
see.
what is the purpose of what you're trying to do?
Yeah.
Right? And what is the bare minimum amount of data you need to do that
Yeah.
and no more?
Right.
So we actually run experiments where we say, if we remove this data element, will we still get the same result?
Yeah.
Right? And if we are building a model and we're using 11 data elements and we have 99.8% efficacy in our model, but we reduce it down to 9 and we're getting 99.7%, is that good enough? Can we work with just 9 instead of those additional data
Yeah.
elements,
Less
right?
information. Right.
Yes.
Yeah.
What is the least amount of information you need to get a correct defensible answer? Not a perfect answer, a correct
Right.
defensible
Yeah.
answer.
Yeah.
And being able to get folks to think that way.
Yeah.
Folks are like, we need to collect all this data, we need to do all this. And question is why?
So you're being very thoughtful and deliberate
You have to be very thoughtful and
as to
deliberate.
just collecting what you need to know and only what you need to know
Yes.
and no more, because then you risk having, the
And then
breaches and the
once you get the
distrust.
answer,
Yeah.
how do we get rid of the data in a safe way?
Ah,
Why do you need to keep it after
why
you
do you
have
need to
gotten
keep
your
it?
answer?
Yeah.
Once you have built your model,
Yeah.
right? You may take a year worth of data, build your model, 18 months to adjust for seasonality.
Yeah.
Once you build your algorithm, why are you still keeping that data that you used to build the algorithm?
Yeah.
Right?
Because now it becomes a liability
It becomes
if it gets breached.
exactly. So
Wow.
that's the other aspect of this. And even with federal records, we talk about that 7-year cycle. And then, so even with AI, it's a lot of times it's about pruning.
Mm-hmm.
One of the best things that happened, which is really is an unfortunate way to frame this,
Mm-hmm.
is we used to have our data models pre-COVID,
Yeah.
and folks are in COVID we built other models.
Yeah.
Now those pre-COVID models are useless. The COVID models are useless. So I keep on telling people that now we have to rebuild models.
Yeah.
So all the data and all the information you had and all the algorithms you had in a pre-COVID and a COVID era, you can throw them away.
Yeah.
There's no point hoarding them. You can really start, and now we're in mid 2026. So we have 18 months of seasonality. You can start with January 25 as your baseline and still
Move
build
forward.
good models.
Build
You
on.
don't need to
Keep
y-
that. Yeah.
you don't need to take 2 black swan events and then try to adjust your model for that, because then your model itself isn't reasonable or sound.
Sure. Yeah. That's incredible. When we think about your look into the future, so you've definitely, I think given us a lot to think about in terms of what's potentially going to be on the horizon, right? And I think good things, obviously. We talked about some of the risks and some of the things that we need to be secure about. What gives you optimism about the future when it comes to transportation and AI's role in its positive impact for healthcare?
It's this idea about utilization, right? We are increasing utilization of our static assets, you know, uh, and that way what we're
Give
doing
us
is,
an example of that, because I think I know where you're going with that.
yeah.
But like you gave
So
a concrete
yeah,
example with the autonomous vehicles taking the healthcare asset
yeah,
to where it's needed or where they are
yeah.
needed. And you talked about the delivery of drones, through medication, blood, and all those other things. But yeah, talk a little bit more about utilization and
So
using our static assets.
everybody here, around the DMV area, for those of your podcast
Yeah,
members,
DC,
it's
Maryland,
DC,
Virginia.
Maryland, Virginia, right? This thing. So every morning, we have traffic that does come this way,
Oh,
right?
boy, do we.
Right? So it's all the traffic that comes into DC. And as you're driving into DC, you look at the outbound traffic and all those lanes are empty,
Yeah,
right? And in the evening, it's the exact
it's the
opposite,
exact
right?
opposite.
So, and Virginia has made some strides in this, which unfortunately, my state, Maryland, has not, with the flexible lanes where
Yeah,
the
yeah,
the
yeah.
adjustable lanes.
Sure.
But it's that idea about if in the morning you need more capacity, you shrink the capacity of the outbound and increase the capacity of the inbound,
Sure.
right? And
Makes
you
sense.
reverse it the other way.
Right.
So, in transportation, we could definitely do a lot of that where even when we see, let's just say, an earthquake,
Mm,
right? What we could do through electronic signaling is signal to all the modern vehicles and cell phones in the area that we're going to reduce, we're going to change the direction of a highway.
yeah.
And we don't need to put up physical signs in there because our autonomous vehicles can immediately adapt and know that it's okay to drive down the wrong way because it's, we have
Yeah.
opened that lane,
Right.
because the autonomous vehicle will stop and say, I can't go down,
Yeah.
one
Yeah.
way, a lane that's one way.
Right.
But what do those signals look like
Yeah.
where we can signal to all the autonomous vehicles,
Yeah.
occupy one more lane? It's okay.
Yeah. In
You
a
know,
networked system, you can do that.
yes.
Yeah.
And, basically, how do we take all our road capacity, all our rail capacity, all our sea capacity, all our air capacity, and we can optimize it so things are moving safely, but we can push them closer. So
Yeah.
we increase the density
Yeah.
that we travel in,
Yeah. I see what you're saying.
right?
Yeah. Making the system more efficient.
And it's also about, when we think about an ambulance. We have seen this in dense areas all the time, right? The ambulance will come up. People don't know it's coming till they hear the Doppler sound, and
Yeah.
this
Yeah.
and then the ambulance is there waiting for about 5-10 seconds till people move off out of their way,
Right.
right? And in certain cases they have to go gently because it's an intersection,
Sure. Yeah.
whatnot, and then you got this stop, go, stop, go, stop, go with an ambulance.
Right.
Imagine if we were able to pre-communicate the ambulance, the AI agent that's dispatching the ambulance is also communicating with the traffic management center, and all the lights are green along the way
Wow.
dynamically,
Yeah.
right? Imagine if those same agents are also communicating with all the autonomous vehicles that say, do not go in this lane because in 2 minutes, although you don't see it right now,
That's
the
gonna be.
ambulance is going to be coming up this way.
Yeah. Well, that resonates with me deeply because
Yeah.
we spend a lot of time in our ambulances bringing the organs back and forth
Yes.
from the hospital, from the airport, etc. So that absolutely makes sense. It's it's a it's an incredibly bold new world that you've painted for us. And what do you think it's going to take for us to really get there at scale? Because there are definitely some, all of the examples that you've outlined, these exist already. The
Yes.
drones are there. They're not being used everywhere, and there's reasons for that. The autonomous vehicles are there. All of these,
Mhm.
different capacities that you mentioned from air, sea, land, rail, they're all assets that we know about, right? We have information. We're gathering all of that information on them right now. But where is it going to take to get to the, sort of the place where all of this is
Yes.
connected in a very seamless ecosystem and being maximized in the way that you've described?
It goes back to thinking about logistics as a force multiplier.
Mm,
Where a lot of times when we think about medicine, we're like, oh, we need to work on billing, we need to fix billing, we need to fix reimbursements, we need to fix some of this, we need to also figure out, we get into this HMO versus PPO care, nobody should get between my doctor and I, right?
right.
But what we forget is, how do you get you to your doctor?
Correct.
And that's the
Right.
logistics piece.
Nothing starts until that happens, right?
Yes. So it's,
So,
can we get you to your doctor in the best way possible? Have we logist communicated the logistical needs to your doctor before you even get there,
mm,
you know, so that they have everything they need in order to properly take care of you?
Yeah.
If you are complaining about, I just, Achilles heel, or I had I slipped and fell while playing softball, and I
Right.
know I need a brace,
Right.
right? Why do you have to go see your physician, go get a prescription for a brace, then go,
Yeah.
somewhere else, pick up that brace, put it on, and somewhere along the way, we have five billing aspects, right?
Yeah.
Where you're taking a picture, right?
Yeah.
And even though the physician is making that final call on the diagnosis, right?
Right.
They have the brace waiting there, right there with them, and they're like, "Here's your brace, put it on. Have a nice day."
Yeah.
Everything's already prepped for the physician. This person is coming in for this. Supplies are here. Here's it.
Yeah.
They're generally healthy. This is what you have done in the past. Just prep that time. So even the time that the physician needs to get ready to see you
Yeah.
is compressed through logistics,
Right.
right?
Yeah.
Physician is ready because they're rested. They got there through autonomy. They have all the logistics they need. And even if the part isn't there, we just have it delivered by drone from one facility to another.
Yeah. Wow. Well, it is a bright future that you're painting, and one that's very exciting. And we're going to wrap up here, but I just I'd be remiss if I didn't just share this little anecdote with you. I was thinking about stories that I read
Mhm.
about healthcare delivered 2,000 years ago, in the time of Hippocrates, and they would bring at the time the patient to the temple, the healing
Yes.
temple, and they traveled by oxen cart. So we've come a long way.
Yes. Yes.
We've come a
Yes.
long way. What myth do you think needs to be demystified about transportation AI in the context of healthcare that you think would be important for the audience to just know about?
So I think the biggest myth that folks need to consider is, yes, space is three-dimensional,
Mhm.
but transportation is not three-dimensional.
Mhm.
We have roads, we channel cars through a particular ways. We don't just let them run around, right? Same thing with rail, right? It's
Right.
very structured. Our waterways are very structured.
Right.
Even our airspace is very structured.
Yeah.
So even though we see the open skies,
Right.
right, we have
Structure.
highways, corridors on our skies
Sure.
that we have to manage. And really, what it boils down to,
Shipping lanes as well.
shipping lanes as well. Exactly. And it's about optimizing those lanes through technology, through AI, so we're getting what we need when we need it, and also in terms of predictive aspects to this.
Yeah.
Where even when we talk about natural crises, like we just had the one in Venezuela,
Yeah.
right?
Right.
Being able to take a satellite picture, being able to see how many people are impacted, so that we're not on the ground trying to figure out what the medical package looks like. We're already working on shipping it there, and no more than what we need, so we're not wasting supplies once we get there.
Yeah. Yeah. So building efficiency,
Building efficiency, absolutely.
increasing and improving access to care, and making our system more resilient.
It's basically taking the waste out of the system, so we're not wasting a medical provider's time, right?
Mhm.
Which is one of their most valuable resources. We're not wasting their time. We're also making sure that they have the resources they need at their fingertips.
Yeah.
We don't need other, five more touch points.
Right.
So it's about the healthcare provider being able to have everything when they need it, how they need it, right?
Yeah.
Within arm's reach, in order to help
Yeah.
their patient.
Yeah.
And that's where the transportation and the predictive transportation and delivery using AI would make a ton of difference.
Yeah. Well, that is incredible. And Neil, I just want to just say thank you so much. I
No,
mean,
no.
you have given our audience, I think, an incredibly unique perspective into how they look at transportation. I hope no one ever drives down the highway, gets on a plane, gets on a ship, or on a rail, and looks at it the same way ever again. Because what you've really shown us and have illustrated so eloquently is how important, as I go back to the beginning, how inextricably connected transportation, healthcare, and AI is and will be, not only now, but in the future.
So I'd like to close with, maybe one anecdote why sometimes
Hmm.
he's, dude, you're taking it so personally, right? Is the first time I deployed to Iraq,
Mm.
right? We all got packages of, I think it was called HEPA starch or,
Yeah, yeah, yeah,
right?
yeah,
Or
yeah,
HEPA stain.
yeah,
The package you can open up.
yeah,
And that actually saved somebody's life,
yeah.
and that came from not just military research, but private research. And it wasn't just about the chemical, the HEPA starch, right? It was about how the packaging goes in,
Hmm.
how that product stays shelf stable while it's next to your body in your
Right,
kit bag, and it's moving around, getting right.
right.
And then and it's also antiseptic. I'm sorry.
Yeah, yeah,
You're right.
yeah. It's sterile. Yeah,
Yeah, it's sterile, right? And I just remember we had a open wound trauma, and we
yeah,
just ripped open the package, put it
yeah.
in there, and that 35 minutes it took for the helicopter to come, the medevac, that person would not have made it
Right,
without these advances in how medical logistics works,
right.
right? Is the medicine we had on our hand, you know, to be able to take care of that. And it wasn't, 15 years ago, that was something that was only available in a hospital.
Right.
You'd have to go to a trauma center to be able to do something like that. And the best we could do was put pressure,
And wait.
on this,
Yeah.
on and wait. And literally the logistics of getting medicine where it's needed on that person
At the time that it's
at the
needed.
time they needed it saved a life,
Saved
and
a
just
life.
made me such a big believer in this.
Yeah.
And it was the whole ecosystem using technology research to build that medicine and then find other ways to package that medicine and keep that medicine to save a life.
Yeah.
Thank you.
Yeah. That's amazing. Well, thank you for your service, Neil. I want to
Thank you for
say
yours as well.
thank you for your innovation. Thank you for your pioneering spirit, and thank you for giving us a lot to think about, and for inspiring us. Because I think that when you think about transportation and artificial intelligence, you probably have healthcare far, far away in your thought process, but it should actually be very close in terms of
Yes.
how things are all connected, and you've demonstrated so well how everything is connected. So I want to say thank you, and I want to say on behalf of our audience, thank you for informing us and for
Well,
giving us all this
thank you
insight.
for this conversation, and it's been a long time coming. And for your audience, I'll close with this: is you and I have sort of like mishmashed here throughout our whole 20-year career,
Yeah,
right? We all know the same
we
people,
all know
but
this,
not at the same time.
right? That's right. And it's been national security and
Yes.
and the study of national security that brought me into, my understanding and appreciation of AI in a different way and sort of outside of my traditional healthcare context. So you're right. We're kindred spirits in
Yes.
that way. So thank you so much.
No, thank you.
So thank you so much for joining us for this episode of Smarter Healthcare with AI. I hope you learned a lot. I hope you took away a tremendous amount of new insight and information. And I hope you really appreciate now how healthcare, transportation, and AI are inextricably connected. Thank you again for joining us in this episode of Smarter Healthcare with AI. I want to thank once again my guest, Neil Chaudhry, for his incredible insight, his service, and for being a wonderful person. Thank you so
Thank
much.
you, sir.
All right.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh is a production of Forbes Books.